In this video, we're going to demonstrate what we call segmental mobility testing of the lumbar spine. This is a test, it's also a treatment. So I'm going to find the most prominent spinous process around the thoracolumbar junction. The most prominent spinous process is usually T12. We can confirm that by palpating ribs, floating ribs that come back onto the transverse processes of T12. So there's T12. So now I'm just going to sink in below the floating ribs with my fingers like this, okay, and not curling my fingers, right? We're using a lumbrical grip. If you use a lumbrical grip and have soft pads of the fingertips, that's always better for your patient. So I'm going to sink my fingers in a little bit. It goes shirt, skin, muscle. So now I'm kind of palpating the muscles, and I'm just going to palpate the muscles from the top down, looking for any differences in tone, stiffness, bogginess, whatever. And then I can palpate and compress the muscles down onto the transverse processes. And after palpating the state of the muscles here, I can rock the lumbar spine itself. Kind of a little bit of side bending, a little bit of rotation. What we're looking for is the freedom of movement, right? So I'm oscillating her spine. I'm pushing it, and then at the height of recoil and the spine wants to bounce back, I'm gonna move with it. So there's definitely a rhythm here. Kind of find the rhythm that works, that's not awkward. Make it easier for you and relaxing for the patient. And I can palpate and I can feel at certain levels of the lumbar spine, on certain side of the lumbar spine, is there hypomobility? Is there muscle tension? And if I feel resistance in a certain part, I can stay there and I can mobilize it and continue to mobilize it. And usually after about 20, 30 repetitions of mobilizing it, you'll feel muscle tone decrease. You'll feel a little bit more freedom in the movement of the lumbar spine. So that's segmental mobility testing, segmental rocking of the lumbar spine. You can also do PA springs, which I don't use very much clinically, but the cool thing about PA springs is they can mobilize the spine, they can give input to the discs and the tissues around through movement, through pumping, through pressure on, pressure off, diffusion gradient, which can reduce discogenic pain, joint pain, muscle pain. We know that grade 1, grade 2 mobilizations activate mechanoreceptors that can bring about pain relief. So grade 1, grade 2 here, we can do grade 1, grade 2 here. As a treatment, but we can also use this as a test, right? And if patients have pain or tenderness reproduced when you're springing on a lumbar segment, that helps you to target perhaps that segment and the segments close to it. One last thing we'll do here is to PA spring L5. So the sacrum has spinous processes as well. And so if we want to know if we're on the sacrum or if we're on the lumbar spine, we're going to go to around the junction and I'm going to spring. And if you can spring it, you're on L5. If you're pushing on it and it's not springing like a lumbar vertebra, then you're on the sacrum.